We see the toll COVID-19 has taken when we look at the number of cases, but those numbers only tell part of the story. As 10 TV's Angela Reichert reports tonight, a recent spike in overdoses in Franklin County is bringing to light the impact the pandemic can have on those battling addiction.
For me, this is something that really hits at my heart.
Chelsea Van Kuren says she knows what it's like to feel alone.
I just got caught up in a lifestyle, and before I knew it, I was way farther than I ever imagined.
A life that once centered on heroin and pain pills, but not anymore.
It'll be 7 years since I've used heroin or pain pills.
Now this is what Chelsea does. She's part of Southeast Healthcare's REACT program. That stands for Rapid Response Emergency Addiction Crisis Team.
I decided I want to be that person that I needed.
During this COVID-19 pandemic, the team is hitting the streets. They're handing out lunches, Narcan, hygiene items, and resource folders to anyone battling addiction.
Recovery so much depends on community, whether it be meetings, the gym, your church community, and by having to isolate or stay at home, a lot of people are finding themselves without that support.
And that can have consequences. Just this weekend, from Friday to Saturday, the Franklin County coroner says they saw 28 people overdose. Here's a closer look at those numbers. From January to April 15th, the county saw a 50% increase in fatal overdoses. In April alone, we're told 62 people died from drugs.
This is really worrisome to us.
Dr. Delaney Smith is the medical director for Franklin County's Alcohol, Drug, and Mental Health Board, also known as ADAM-H.
People aren't choosing to relapse, but all of the stress can really combine to create this perfect storm for people who are doing great in their recovery.
She says right now it's important to keep a routine, wake up, eat, and exercise at the same time.
They seem simple, but they really make a big difference.
And so does keeping up with your mental health or substance use provider.
It may be by video camera or telephone instead of face-to-face, and that can present challenges for people, but they are still there and they still want to hear, from you and get you engaged in treatment.
For Chelsea, her best advice is to simply be there for your loved ones, even when you can't be in person.
You don't know what's going on behind closed doors, and you just have to kind of check on each other.
Reporting in Columbus, Angela Reichert, 10 TV News.
If you or someone you know is struggling with abuse, there is a way to get help. Just visit don'tliveinDenial.org for resources you can use today.